Today, we're diving into a battle that's happening right now, in hospitals, and maybe even closer to home than you think. We're not talking about a visible enemy. Nope, this one's microscopic, but it's become one of the most dangerous opponents in all of modern medicine. The superbug Pseudomonas aeruginosa.
And if you're thinking this is some far-off, abstract threat, think again. Just last year, in 2023, the CDC put out a really stark warning. An outbreak of a highly resistant strain of this bug was traced back to something found in millions of medicine cabinets, over-the-counter artificial tears. Suddenly, this fight wasn't just in the ICU, it was right at our front door. That's why we need to talk about this, now more than ever.
All right, so let's get properly introduced to our microscopic antagonist. First up, we're going to meet this formidable superbug, Pseudomonas aeruginosa.
So what is this thing exactly? Well, technically, it's a gram-negative bacillus. All you really need to know is that this gives it a kind of natural body armor, a tough outer membrane that makes it way harder for antibiotics to get inside. And this bug is everywhere. I mean, soil, water, and, you guessed it, hospitals and clinics, where it just loves moist environments. It's one of the top causes of really nasty hospital-acquired infections. And for patients whose immune systems are already weak, it's incredibly dangerous, with a tragically high mortality rate.
But here's the thing. Its true strength, its superpower, isn't just its ability to cause an infection. It's how it defends itself against our cures. And that brings us to the absolute heart of the issue, the resistance problem. This bug is a true master of defense.
Okay, so its defense system has a few levels. Level 1 is called multi-drug resistance, or MDR. So picture our antibiotics as different kinds of weapons, right? You've got your penicillins, your cephalosporins, and so on. An MDR bug has figured out how to build a shield against at least 3 of those different weapon classes. Right away, our treatment options start getting pretty thin.
Then, things get even more serious. The next level is extensively drug-resistant, or XDR. Now the bug is resistant to nearly every single class of antibiotic we have in our arsenal. At this point, doctors are down to maybe 1 or 2 drugs left to even try. The shields are up against almost everything we can throw it at.
And this is the absolute nightmare scenario. Pan-drug resistance, or PDR. This is when the bacterium is immune to every single available antibiotic agent. Every last one. Our entire arsenal is useless. We have no weapons left. This is, quite literally, an unbeatable bug.
And let me be clear, this isn't some science fiction what-if. This is real, and it's happening now. Just look at the data. Between 2018 and 2021, over 15% of Pseudomonas infections causing pneumonia in patients on ventilators were already multi-drug resistant. That's more than 1 in 7 cases, right there in our most critical care settings. The problem is already here.
But we are not taking this lying down. Humanity has developed an incredible array of medicines to combat these threats. So next up, let's take a look at our antibiotic arsenal, the weapons we are using to fight back.
This here is the standard toolkit. These are what we call the first-line agents, a whole bunch of different classes of antibiotics that doctors turn to first. You got things like penicillins, carbapenems. These are the workhorses, the go-to choices for a typical Pseudomonas infection, as long as the bug hasn't learned to resist them yet.
Okay, but what happens when that first line of defense fails? Well, that's when you call in the special forces. These are the newer, more powerful drugs, specifically designed to take on resistant strains. We keep them in reserve, partly because they're expensive, but mostly to slow down the bug's ability to figure them out too. These are the big guns. And polymyxins, well, those are the absolute last resort, the nuclear option, because they can be pretty harsh on the body.
Now, this brings us to a huge strategic debate when treating these infections. It's not just about which weapon you use, it's about how many you use at once. This is the combination dilemma, and it's all about choosing the right battle strategy.
So what do? Do you go in with one powerful drug, or do you hit it with 2 at the same time? A single drug, that's monotherapy, is like a sniper shot. It's a targeted attack. It's got a lower risk of side effects, it costs less, and it's perfect when you know exactly what the bug's weakness is. But combination therapy, using 2 different drugs, that's a full-on assault. You use this in a high-stakes emergency, like when a patient is in septic shock, or you have a strong suspicion you're dealing with a resistant bug. The goal isn't precision, it's to maximize the chances that at least one of your weapons will find its mark.
And that's really the bottom line here. Combination therapy is a race against the clock. See, the lab tests that tell you exactly which antibiotics will work can take days. For a patient who is critically ill, you just don't have days. So using 2 drugs right away is a strategic bet. A bet to make sure the patient is getting life-saving treatment from the very first hour.
But even with our best strategies and our newest drugs, the battlefield is always changing. And this brings us to our final and maybe most sobering section, fighting the unbeatable. This isn't just a battle, it's an evolutionary arms race.
It's this vicious cycle we seem to be trapped in. Here's how it works. We use one of our best, newest antibiotics. It works great at first, but a few of the bacteria manage to survive. Those survivors then multiply, creating a whole new generation that's resistant to that drug. But here's the truly scary part, this thing called cross-resistance. By learning how to beat one of our new drugs, the bacteria can sometimes automatically gain resistance to other new drugs, ones it has never even encountered before. It's like it goes to a training camp against one weapon and comes out knowing how to defeat 2 or 3.
The speed of this is it's mind-blowing. Check this out. In one study, patients were treated with one of these new generation drugs. After the treatment, scientists tested the bacteria that survived to see how they'd fare against a different new drug. The results were staggering. 86% of the bacteria, which were previously susceptible, had suddenly become resistant to the second drug. Let that sink in. The bug beat 2 of our best weapons by only having to fight one of them.
And that leaves us on a real cliffhanger with the most critical question for the future of medicine. We are in a relentless race against an opponent that evolves at a terrifying speed. So, as this superbug continues to get smarter, get stronger, and build up its fortress of resistance, the challenge for all of us is stark. Can our science actually evolve fast enough to keep up?